All right, let's get started. And again, I'd like to thank Paisan for giving me the honor to be the first speaker for APTOS and to give a broad overview on large language model generative AI, so which is a huge challenge. And thanks again, Paisan, for this wonderful honor. So, as you can see from the program, we have 4 speakers this morning, and it's a very nice chain sequence of what we're going to talk about on large language models. But to break it down simply, I will touch on a broad overview on the development, the evolvement of large language models, some of the evidences, findings from off-the-shelf large language models like ChatGPT, BART, for example. And then our following speakers, they'll touch on more on customized large language models, which we'll hear a little bit from Dr. Liu Yun on MapPalm, etc. So, for the nature of this talk, it's important to say that I have no financial disclosures. And these are my outlines. As I mentioned, we'll touch a little bit on the history, the concepts, some of the current performances, and more importantly, what's next, what are the potential use cases, etc. So it's important to let the audience understand that large language model is part of the big family of generative AI. And in generative AI, it's not just about putting a text, it generates a new text. It can be many forms. It can be text to text, text to code, text to audio, text to image. Even if you put in an image, now it can give you a result, which I'll show some examples later. And of course, in addition to ChatGPT, these are many other companies and products which are out in the market now. Some which are free to use with certain limit, and some actually with some credits, actually they are widely available now. So, what happened in the past 12 months since ChatGPT was released in November? Essentially, I will argue with this title, how AI chatbots change the internet. It's not changing about the internet. It changed the world, actually. It changed the world. And to quote Bill Gates, and if you read his blog, this was what he wrote in March. Essentially, he realized that he witnessed something that he saw the second major evolution that he himself started in the 1980s, where he started all the PCs. So he saw that this is the next big wave, and he thinks that this can change and potentially improve climate change to global health. So that's how big it is. And we are fortunate in the sense that we are right in the middle of this, and we are also involved in healthcare as well. And moving forward, fast forward a few months later, of course, in addition to ChatGPT, you have additional players coming in. Everybody wants a piece of this field as well. So it's getting very exciting. But I'd like to share with the audience that the whole wave hype of large language model didn't just start last year, November. It actually started way before. The whole concept of natural language processing, NLP, actually started in the 60s. And it started as some statistical large language models. But the turning point came in 2018. That's my personal view, where Google introduced BERT. And then came 2020, GPT-3 made the first breakthrough. Then GPT 3.5 was released in November last year, 2022. And subsequently, of course, we have ChatGPT 4. And of course, along the way, Google Bard came into the picture. Llama by Meta Group came into the picture as well. So what is a large language model? Essentially, it learned, it was trained from a very diverse data, website information, online sources, articles, etc. And then why, you may ask, how come it suddenly have this bloom? Because of foundation model, which our speakers will touch on a little bit later. And of course, we have better hardware, GPUs, etc. But more importantly, the transformer model architecture, that was the major turning point as well. And data, essentially more and more data are becoming available, and they are widely available online. And now that they have come up with a way to efficiently leverage on this data with more advanced model architecture, all these factors come together, which led to this bloom in large language model. So in a nutshell, of course, training data can come in many forms, as you can see here, text, speech, etc. And of course, they can essentially perform several tasks. But more importantly, I would like to introduce some key concepts first. And this is a very good reference if you would like to start off by understanding how potentially large language models can be trained, customized for clinical use, healthcare use. So in this article, they briefly share 4 potential models, and I'll touch on the first one, which is what they call in-context learning. So take ChatGPT, for example. ChatGPT was trained on general text all over online resources, etc. Then they have the model. But was it meant to be used for healthcare? The answer is no. It's not meant to use for healthcare only. So it then became potentially useful for healthcare with prompting, where we key in a query related to medical queries, then it came out with a medical-related answer. But it was not originally trained for healthcare use. Then came fine-tuned general model. So general text is the foundation model. Then you fine-tune on specific medical data. Then it became a clinical model that you can use as a chatbot. And one example is Chat Doctor, which they fine-tuned on Llama as the foundation model. And then another third model is a specialized clinical model, whereby the foundation model, it's not all the online resources or Wikipedia. The foundation model itself, it's already a medical database. So that this clinical medical data bank formed the foundation model, and then they further fine-tune using more refined medical data as well to come up with an AI chatbot. And this is one example, the Generative GPT. But the most advanced one, in my opinion, what we have witnessed so far, it's the ones that is using foundation model trained on all the online resources and wiki, and then further fine-tuned based on clinical guidelines and further fine-tuned based on medical data, and then coming out with the final model. And one example is MedPalm, which our next speaker will share shortly. So what is the use of large language model in medical domain so far? And early this year, you probably saw a lot of papers, they assess their performances on medical exams. For example, this paper, they show that even with ChatGPT 3.5, it has passed the US MLE exam. And this paper, very famous, published in JAMA Internal Medicine. Not only that it could quite accurately answer patients' queries, but it showed optimal level of empathy. So this made quite a huge wave when it was first released. And of course, in ophthalmology, it was also shown that it actually did quite well for OCAP. ChatGPT 4 even outperformed ChatGPT 3.5. And when it comes to their performances in the Royal College ophthalmology exams, they also show that all large language models that we have off the shelf so far, most of them, they perform well enough to pass the ophthalmology exam. But beyond that, I often question this. So all these are interesting. So there are several papers out there, but we show that they can pass medical exams. So what does this actually mean? How does this impact patient, and how does that impact our clinical care? But more importantly, once these papers are out, right, what signal are we sending? And what do I mean by that? Even before large language model came into the picture, it was already evident that our patients, public members, they are receptive to the idea of searching on the internet and look for answers themselves. And they're comfortable doing that. And now with ChatGPT 3.5, with all these papers coming out saying that they can actually pass medical exams, how does that influence public's perception? And in this paper, they did a survey, and they found that actually close to 80% of people are comfortable using ChatGPT 3.5 for self-diagnosis. So that can be a little bit risky and a little bit dangerous, because we all know that all these large language models, they are great, but at the same time, they have limitations, which is why we need to perform robust evaluations on all these models. So the next question I'd like to ask is, are they really safe to be used to answer medical queries, even to allow patients to do self-diagnosis? How about their performances in subdomains, in specialty like ophthalmology, even subspecialty, pediatric ophthalmology per se? So to illustrate their point, my group further evaluated the performances of these off-the-shelf models in myopia care. And we published this about 2 months ago in eBiomedicine. So in short, we did a robust evaluation. We have 3 players, in this case, ChatGPT 3.5, 4, and Google Bard. We randomized them, we concealed all these responses, then we fed them to 3 experienced pediatric ophthalmologists to evaluate the quality of the responses from these large language models. So if the responses are deemed to be good based on majority consensus, then we further evaluated for the comprehensiveness of the response. Sometimes the response may be accurate, but they may be missing some key information, so which is why we also evaluated comprehensiveness. If the response is poor, then we actually prompt it to try to see whether the model can self-correct. So that's what we evaluated as well, self-correction. So as I mentioned, we sum up the performances and based on majority consensus, and these were the domains that we evaluated in terms of myopia care. You can read our paper to find out more. Overall, we found that ChatGPT 4 performed the best. slightly better than Google Bar. And when it comes to evaluating the proportion of good responses, ChatGPT 4 performs the best as well. In terms of comprehensiveness, they are largely similar. So the second example is, can they be used as a tool to answer general ocular symptoms? Because this is quite common, and if useful, it can help us with triaging as well. So we have published this from our group in eye science. We looked at 37 most common ocular symptoms based on some guidelines and some web queries from AAO and other international websites. So these are some examples of the ocular symptom questions. But in short, we found that ChatGPT 4 performs slightly better than GPT 3.5 and Bard in terms of answering ocular symptoms. And you can see that it has the highest proportion of good responses when it comes to tackling these queries. And similarly, there's another work that's published in JAMA Network Open, which looked at these off-the-shelf large language models on answering patient eye care questions. They evaluated 200 questions, which is even more comprehensive. Hence, I would like to share this here. So feel free to take a look. But despite all this hype, and I show some promising findings, but I have to highlight that there are still some key limitations. Number one is hallucination, which led to potential misinformation. Of course, the actual training data used to develop these large language models are still not entirely clear. So obviously, there will be hidden bias. It's likely to be an underrepresentation of the data as well. But more importantly, these off-the-shelf language models are not customized, not specifically trained on medical information. Therefore, they are not meant to be specifically used for medical use, actually. So moving on, fast forward September 2023, ChatGPT announced this, that ChatGPT now can see, hear, and speak. What it means is it can read images. So the next challenge is, can it actually read retina photos? In other words, large vision language model. So to do this, we did a mini experiment. We uploaded this photo to the latest version of ChatGPT 4, and we prompted ChatGPT 4 in this manner. Is this retina normal or abnormal? If abnormal, please identify any potential abnormalities. And what ChatGPT 4 did was this. So it looked at this image, it processed it, it enhanced the contrast, it did something to the color saturation. It came up with this first response. So based on this processing, it came out that potentially there are some juicings, there's potentially some exudates, hemorrhage, all this. And based on all these observations, the possible diagnoses are, number one, maybe DR, number two, macular degeneration, etc. So what we can see here is, it is getting smarter, but it's not getting any more specific. It is showing you tons of possible diagnoses without giving you a definite answer. But this is just the start of it. Very likely it will improve further, and it's a very exciting field. So how can we apply large language models in ophthalmology? As we all know, our current eye care model is convoluted. It has multiple points. We need to identify the point, the flow, where we want to apply large language models to potentially help us to do better for clinical care. So last week, we have this published in Lancet Digital Health. I'm happy to share with you all. And in this viewpoint, we propose several potential new models as a reference with our audience here. So one reference is potentially, as I said, to address ocular symptoms to help us to better triage. So which are the ones that actually are not urgent or actually do not require referral, they go back to primary care. Those which are more urgent, they go to tertiary care, for example. And of course, since large language model can do such a great job in processing unstructured information, unstructured text to structured text, it is possible that even when it comes to medical recording or medical audio records, it can help in terms of summarizing things in a more concise and informative way. But it's important for me to mention that with the advancement of technology, we should not neglect other under-resourced settings which may fall behind in this whole wave, so which is why we also wrote another viewpoint addressing this issue as well. So what is the next wave? The next wave is very exciting, not because of course, with all the advancements of the model architecture, but to me, because of foundation model. Foundation model is now a key piece to the whole AI space, generative AI space. And as you can see, these are the multiple examples of foundation model. And one example of foundation model plus fine-tuning is MedPalm, which Yun will share later. So it's essentially, Palm is the foundation model. It was trained based on general text or Wikipedia, etc. further fine-tune based on medical data, further fine-tune based on even more refined medical data, and coming up with a final model that is specifically designed, catered for medical use. And that can happen for general medicine, that can also happen for ophthalmology as well. So which is why, because of foundation model, and it allows us to do even more granular fine-tuning, I see that this field is going to further expand and further blossom in many different areas. So I have no financial disclosure, I have no links to Google, but I just want to promote a little bit. This is one very good paper from Google's group, published in Nature, and some of the findings from the MedPalm will be shared shortly. But before I close, I'd like to share that we need to emphasize on robust evaluation for all these emerging models that are coming up. At the moment, there's no standard way of evaluating these models, and it's very challenging to establish ground truths when it comes to large language model responses. But we need to keep going, and we need to come up with a robust framework to regulate all these upcoming models. So yes, the technology is already here actually, but we need to define the use cases. What can they be used for? They probably can't be used for all domains of ophthalmology. They can't change all the flow of ophthalmology, but certain flows, we need to define that. And I would urge to have a clear end deployment in mind, what we want it to be used for, then we work backwards. Work backwards meaning we probably need to develop, customize our own large language models which can serve that end deployment in mind. And lastly, of course, we need robust evaluation. So with that, I shall end my talk, and I'd like to credit to my team, my students, for all the fantastic work. Please feel free to connect with me, and if there's a chance, I'll welcome you to Singapore and to visit our campus, National University Singapore. Thanks very much.